Okay.
Okay, this is sterile dressing change. Again, I've already got the bed ready to hide. They're close enough to hide. I've tried to drape him so no more needs to be uncovered than necessary. I don't have a Penrose drain, but you can do about the same either way. This is kind of a different wound, but I'll demonstrate it as if it was like a Penrose drain. The first thing you want to do is when you want to take the old dressing off, and when you take the old dressing off, you need to, again, make sure you have clean hands and then just clean gloves on. You don't want to start out with anything sterile yet, so you just put your clean gloves on. And with your clean gloves on, if there was tape on here, you would carefully remove all the tape, not to tear their skin when you're removing it. And then we've always been taught, when you take the dressing off, you don't want to take it off so the patient can see it, because sometimes patients don't tolerate it, the appearance of it or whatever. So you take and you open it or take it off away from the patient, okay? When you take it off, you always want to make sure you observe your old dressing so you know how to document whatever was on there. Was there blood? Was there serous drainage, serosanguinous drainage, sanguinous drainage, which would be the bloody drainage. So you need to check and see what's on there. Once you've looked at that, you take and you close it all up in your glove. You always want to contain your old dressings as much as you can. And then trash it, okay? Now pretend this is a Penrose drain, because with this wound you would want to go ahead and clean it up. But with the Penrose drain, you really shouldn't need to do any major cleaning around it or whatever, okay? Before I start with my sterile procedure, I want to make sure my hands are clean again after messing with a dirty dressing. So either use a pump of the sanitizer or rewash your hands. When you come back, supplies you'll want is a pair of sterile gloves. You want your drain sponge, your surgical sponge, and your ABD pad to cover it up with. And then you're also going to want tape to tape around the entire dressing. The first thing I'm going to do, just leave your sterile gloves off to the side. Everybody always wants to open their sterile gloves, but leave those off to the side. And I'm then going to open each package, carefully open it, okay, pull it back. Make sure your dressing doesn't touch the table or fall off the package. They really don't give you your 1-inch margin with these, so you just have to be very careful. Once you've opened that one, carefully try not to open them like this. You want to try to open them right over the top so you're not going over other dressings. Again, carefully open. And then you're going to take and open your ABD pad. As you can see, this one would not be sterile because it's already over the edges. But we're going to pretend that it is sterile. So you've got your 3 dressings that are sterile. Then I'm going to kind of turn my table and I'm going to open my gloves. Now what you have to make sure when you open your gloves is that you don't open them to where they're going to touch your sterile dressings. Carefully open your gloves. And you always want to try to keep this on the table. You don't want to be opening your packages on your patients or whatever, because your patients can move and break your sterile field. Okay. So open your package, again, gloves. You notice when I put my gloves on, I put my gloves on up here and not down here to where I have the chance of hitting something while I'm doing it. Thumb up again. Okay, I have that like that. Don't mess with that down here, because if you do, you're going to end up breaking your sterile field. Okay, just leave it. It will be fine. Okay. Now, I've got my dressing. Okay. It's good to have a table that rolls if you can. Works the best. Okay, I'm going to take and I'm going to have a clean hand and a dirty hand. If I had my Penrose drain, I would take and I would get a hold carefully of my Penrose drain with one hand. Okay, so So that's now considered your dirty hand. And if you would need to do cleaning, you would have to do it before you put all your sterile gloves on, and be careful as to how you do it. But you shouldn't have to. Hold this Penrose drain up and then carefully take your drain sponges, and I put one direction and the other one a different direction. So carefully take, and under your Penrose drain, set it. Now be careful when you put it down so you don't take and touch your fingers against the skin when you slide it under. So you want to try to hold it this way to slide it under. Grab your second one because your hand's still sterile and you're holding, your Penrose drain. Turn it just a little if you have to, and again, slide it under with your second one. Okay? So they overlap as much as they can. I take my gauze, got my Penrose drain. Sorry, you guys, it'd be better if I actually had it. Cover it with that, and once you cover it with that, you no longer have a hold of your Penrose drain. The Penrose drain is kind of setting under there. Okay? Take last these. Okay. Cover it. You no longer need to be sterile. Okay? Once you have it covered, and then you would just take and tape the entire area around. Okay. Again, these are large ABD pads. You may not need something that large. Depends on how much it's draining. Once you've got it taped, then you can take and take your gloves off, cover the patient back up, check and make sure he's doing okay, any needs or anything, and then document as you would with all the procedures. Document what you did.